Okay, Bismillahirrahmanirrahim. Now we are starting again. This is our part 2 of the Viva, important Viva questions of lower limb. Which bone forms the hip joint, head of the femur, and acetabulum of the hip bone? What deepens the acetabulum? Acetabular labrum is present. Name the main ligaments of the hip joint. Like the shoulder joint, ligaments of the hip joint is also important from the Viva point of view. That is iliofemoral, pubofemoral, femoral. You can learn from the femoral, iliofemoral, pubofemoral, ischiofemoral. You must know the three. There are three bones forming the hip joint, that is ilium, ischium, and pubis. Okay, so learn the ligaments like this. So the ligament will be iliofemoral, pubofemoral, ischiofemoral, and the ligament of the head of the femur, that is ligamentum teres. Which is the strongest ligament of the hip joint? It is the iliofemoral ligament. Which ligament prevents hyperextension of the hip joint? Iliofemoral ligament, because it is the strongest one. Which ligament prevents hyperabduction? Pubofemoral ligament prevents hyperabduction. Okay, which ligament prevents hyperextension and medial rotation? Which ligament prevents the hyperextension and medial rotation? What is the role of the ligament of the head of the femur? It transmits the branch of the obturator artery to the head of the femur. What is the blood supply of the hip joint? Medial and collateral. This is the blood supply. Blood supply is very important of all the joints, knee joint, every joint. For the blood supply of the hip joint, medial and lateral circumflex femoral arteries, branch of the obturator artery, superior and inferior gluteal artery is very important. Which artery is most important for the head of the femur in adults? Medial circumflex femoral artery. Which movement is more free at the hip joint? Flexion or extension? Why? The flexion is very important because ligaments are relaxed in flexion and taut in extension. Okay, you must know this thing. Which movement is free at the hip joint? You must know flexion is free, not the extension. Okay, name the main muscles producing flexion of the hip. That is by which muscles? Iliopsoas muscle. I have shown in my one video that how the iliac and psoas muscle are present, and iliopsoas muscle, rectus femoris, and sartorius muscle, they perform the flexion of the hip. Name the muscles producing extension of the hip. Gluteus maximus and hamstrings. Hamstrings, I have already told you the three muscles that were semimembranosus, semitendinosus, and which other one was included in the hamstrings? I have also forgotten. Bicep femoris. Okay, now let's come to the name the main muscles for producing flexion of the hip. Iliopsoas, rectus femoris, sartorius, which we have discussed. Name the main muscles producing extension of the hip. Gluteus maximus and hamstring muscles. Which muscles causes abduction of the hip? Adduction of the hip by gluteus medius and minimus, supplied by the superior gluteal nerve. Which muscles causes adduction of the hip? Adductor group, adductor longus, brevis, and magnus. Which muscles laterally rotate the hip? Lateral rotation by the gluteus maximus, supplied by the inferior gluteal nerve, piriformis, obturator internus, and quadratus femoris, nerve to quadratus supplied it. Okay, which muscles medially rotate the hip? That are gluteus medius and minimus. Okay, the similar question. Okay, which movements are important for walking? Flexion, extension, and abduction, and medial rotation are important for walking. Or that can be asked to you that which muscles perform flexion, extension, abduction of the knee so that a person can walk. What is congenital? The dislocation of the hip, displacement of the femoral head from the acetabulum present since birth. What is the clinical importance of the hip joint? Blood supply. Injury to the medial circumflex femoral artery, it leads to the avascular necrosis of the femoral head. The question can be asked to you that why is the which bone can lead to the avascular necrosis in the lower limb? This will be what? Avascular. This will be the femoral head. And why? Medial circumflex, due to the nerve injury to the medial circumflex femoral artery. Why is the fracture of the neck of the femur dangerous in elderly? Because it may lead to femoral head avascular necrosis, as it damage the blood supply to the femoral head. How are the thigh muscles divided? They are divided into the three compartments: anterior, medial, and posterior What encloses these compartments? These compartments, fascia lata and intermuscular septa. In my one video, you can see the tensor fascia lata, and the other thing you can intermuscular septas you can also see. Name the muscles of the anterior compartment: sartorius, quadriceps femoris, rectus femoris, vastus lateralis, vastus medialis, vastus intermedius, iliopsoas and pectineus muscle. They are present in the anterior compartment, and you must. What is the nerve supply of the anterior thigh muscles? Femoral nerve, except the psoas muscle, which is directly supplied by the lumbar plexus. Direct branch is given to you. Lumbar plexus is also very important. Please learn the lumbar plexus by your own. Main action of the anterior thigh muscles: extension of the knee and the flexion of the hip, which is the longest muscle of the body. It is a sartorius. It was going tilted in the thigh. You can see it in the thigh model video. Which muscle is the chief extensor of the knee? I am talking about the knee, not the hip. Please listen to the Viva question carefully and then answer accordingly. Chief extensor of the knee is quadriceps femoris. What is the insertion of the quadriceps femoris? The tibial tuberosity by patellar ligament. Quadriceps femoris is attached. Name the muscles of the medial compartment: gracilis, adductor longus, adductor brevis, adductor magnus, obturator externus. What is the nerve supply of the medial compartment? Obturator nerve, except the adductor magnus, which is supplied by the sciatic nerve. And sciatic nerve का भी कौन सा part? Tibial part. Main action of the medial thigh muscle is adduction of the thigh, because they are present on the medial side. Today, few better use your common sense that those muscles which are present on the medial side, they are going to adduct the thigh, na? They are not going to abduct it. Abduction will be performed by the lateral muscles, lateral compartment, you can say, which is the only adductor muscle crossing both hip and knee joint. It is very important. You must know gracilis is the only adductor that crosses the hip and the knee joint. Which adductor muscle also extends the hip joint? Hamstring part of the adductor magnus. Name the posterior thigh muscles. It is the bicep. Name the posterior thigh muscles. It is the bicep femoris, semimembranosus, semitendinosus, and they are supplied by the sciatic nerve. Tibial part, except short head of the bicep femoris, which is supplied by the common peroneal nerve. What is the main action of the posterior thigh muscle? Extension of the hip and flexion of the knee. Muscles of the charts of the please learn the table or the tables of the KLM and the clinical boxes which are given at the end of the each chapter is very, very important. Which posterior muscle laterally rotate the knee when flexed? This is the bicep femoris. Which posterior muscle medially rotate the flexed knee? This is semitendinosus and semimembranosus. What is the clinical importance of vastus medialis? It prevents the lateral displacement of patella, because it is present medially vastus medialis, so it is prevent the lateral displacement of patella को prevent करेगा. Which thigh muscle is commonly used for tendon graft? Gracilis is used for tendon graft. Why is adductor magnus called a composite muscle? Because it is supplied by both obturator nerve, adductor part is supplied by, and sciatic nerve, hamstring part. Adductor magnus has two parts. One part, adductor part, is supplied by the obturator nerve, and the other part is supplied by the sciatic nerve, tibial part. Which muscle form the hamstring muscle? Again, repeated question. Bicep femoris, semitendinosus, semimembranosus, and still part of the adductor magnus. How are the muscles of the leg divided? They are divided into the three compartments: anterior, lateral, and posterior. Which structure divides the leg into compartments? Which structure? Obviously, you know, septa, interosseous membrane, and deep fascia. What name the muscles of the anterior compartment of the leg? Tibialis anterior, extensor hallucis longus, extensor digitorum longus. They are present on the anterior side, and peroneus tertius. What is the in the model which I have shown in my video? There is peroneus tertius is not visible over there. Okay, what is the nerve supply of the anterior compartment? Deep peroneal nerve. It will be present on the anterior compartment side. So the nerve which is visible on the model, which is present on the anterior compartment, that will be deep peroneal nerve or fibular nerve, you can say. Both are same. Main action of the anterior compartment is dorsiflexion of the foot, extension of the toes. Name the muscles of the lateral compartment: peroneus longus and brevis. And what is the nerve supply of the lateral compartment? Superficial peroneal nerve supplies the lateral compartment. Main action of the lateral compartment is eversion of foot and weak plantar flexion. It is now you are understanding what will be the function of the lateral compartment. Eversion of the foot. I am going to show you a video of that also. Okay, how is the posterior compartment divided? It is divided into the superficial and deep groups. Name the superficial posterior muscles. Superficial posterior muscles will be on the superficial posterior muscles in my thigh and the leg video. You can see the medial head and the lateral head of medial and the lateral head of the gastrocnemius muscle, soleus muscle, and the plantaris muscle, which is going like a tree-like or a plant-like. It is going in the model. Name the deep posterior muscles. Tibialis posterior will be present just like on the anterior compartment. Tibialis anterior was present. So on the deeper posterior muscles will be the flexor digitorum longus on the posterior side, and flexor hallucis longus and popliteus muscle. What is the nerve supply of the posterior compartment? Tibial nerve supplies. Main action of the posterior compartment is plantar flexion learned from the P or P. Posterior compartment plantar flexion of the foot, and inversion tibialis. Inversion is performed by the tibialis posterior mainly, and flexion of the toes. Which muscle form Achilles tendon? Okay. Sorry, I have forgot. I remember this thing. The gastrocnemius muscle, both heads of the gastrocnemius muscle, medial head of the gastrocnemius muscle, lateral head of the gastrocnemius muscle, and soleus muscle. These three muscles together forming the Achilles tendon, or you can say they are inserted on the Achilles tendon or tendocalcaneum. These are the two names for the Achilles tendon or tendocalcaneum or calcaneus tendon. These are, and the few books says that plantaris is they include plantaris also. Acha, where does the Achilles tendon inserted on the Achilles tendon? Now Achilles tendon is inserted into the posterior surface of the calcaneum or calcaneus. Both are the same. What is the main action of the Achilles tendon? Plantar flexion of the foot. Okay, plantar. What is the nerve supply of Achilles tendon? Tibial nerve. Obviously, Achilles tendon is formed by which muscles? Gastrocnemius, so which is supplied by the tibial nerve. What is Achilles tendon reflex? Contraction of the gastrocnemius and soleus plantar flexion when tendon tapped. Which spinal roots are tested in Achilles reflex? S1 and S2, mainly S1.